Have you ever experienced intense cramps, unpredictable cycles, or even painful intimacy and wondered if it's more than just bad periods? You're not alone. And it could be endometriosis. Hi, I'm Dr. Mickey from the Health and Wellness team here at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're diving into the often misunderstood world of endometriosis, what it is, what's really going on in the body, and what steps you can take, starting today, to manage your symptoms and protect your fertility. Let's break it down. Endometriosis happens when tissue similar to the lining of your uterus, called the endometrium, starts growing outside of it. Most commonly, it shows up on your ovaries, fallopian tubes, bowel, and the thin wall of tissue between your uterus and rectum. And while that might sound like just an anatomical hiccup, the way it affects your body can be life-disrupting. Common symptoms? Painful periods, deep pelvic pain, pain during or after sex, heavy or irregular bleeding, digestive issues, and even trouble getting pregnant. In fact, among young women experiencing pain or infertility, as many as 1 in 2 could have endometriosis. One of the most accepted theories about why this happens is called retrograde menstruation. Basically, instead of your period blood flowing entirely out of your body, some of it flows backward through your fallopian tubes into your pelvic cavity. From there, that endometrial tissue can implant itself and grow where it's not supposed to. Here's the catch. These tissue patches may act a lot like the lining inside your uterus. That means they respond to hormonal changes each month, building up and then breaking down. But since they have nowhere to go, this leads to internal bleeding, inflammation, scar tissue, and pain. Now, here's something even more interesting and important if you're thinking about fertility. Your uterus isn't just a passive space where things happen. It has natural muscular wave-like movements, called uterine peristalsis, that actually help guide sperm toward the fallopian tubes and prepare the uterus for a potential pregnancy. These movements are carefully timed and hormonally regulated throughout the menstrual cycle. In a healthy cycle, early on in what's called the follicular phase, these waves help transport sperm from the cervix up toward the fallopian tubes, right where fertilization usually takes place. Around ovulation, the movements become more frequent and stronger. But in people with endometriosis, these rhythms get thrown completely off. The uterus contracts more frequently, but without rhythm or coordination. It's like a traffic jam of muscle contractions instead of a smooth ride for sperm and embryos. That may be one important reason why endometriosis is linked to infertility. In fact, studies show there's significantly less sperm making it to the fallopian tube, where fertilization occurs in those with endometriosis, possibly up to 3 times less. So, what can you do? First, know that you're not powerless. While there's currently no cure, there are effective ways to manage the condition and reduce its impact on your daily life and future fertility. Mild cases may be managed with birth control pills to regulate hormones and reduce symptoms like painful cramps or irregular bleeding. Over-the-counter pain relievers like ibuprofen can help with inflammation and pain during your period. Heat therapy, think heating pads or warm baths, can also work wonders when cramps flare up. Some people even report symptom improvement from anti-inflammatory diets, rich in leafy greens, omega-3s, and low in processed foods. And pelvic physical therapy may help with painful sex and chronic pelvic pain. For those trying to conceive, assisted reproductive techniques like IVF may be an effective option, especially if other treatments haven't helped. But keep in mind, surgical removal of the tissue can have high recurrence rates and isn't always a cure. If you're navigating this, it's important to talk to a doctor who specializes in reproductive health. Worried about your own symptoms? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket, always 100% free. And if you found this video helpful, don't forget to like and follow for more doctor-approved info you can trust from UB Health.